My name is Dr. Elizabeth Kuta. I'm a consultant pediatrician and neonatologist at Aga Khan Hospital, Kisumu. Today is World Sickle Cell Disease Day. What do you know about sickle cell disease? Sickle cell disease is an inherited disorder of the hemoglobin, which is a protein that carries oxygen in the blood within the red blood cell. So there's a genetic mutation on this hemoglobin, and that makes the red blood cell change shape into a sickle shape or rather disc shape, which is less flexible and does not move through the blood vessels easily. And therefore, the red blood cells tend to stick to each other and to stick on the walls, and therefore resulting in blockage of the vessels. And this is how you end up with the crisis in sickle cell disease. So among the various symptoms of sickle cell disease, most babies are asymptomatic. Asymptomatic means they have no symptoms in the first 6 months. Some who are unlucky may have symptoms earlier than the 6 months, but most of them are asymptomatic. So they present mainly at around 5 months to about 9 months. And the first symptom that we see for most of our babies is the dactylitis, which just means that there is a swelling on the fingers, and they tend to get very painful swelling on the fingers, and that's how we are able to pick them up, and that's how we end up screening them and finding out if they have sickle cell disease. But going forward, they get more and different crises. So they can have the other sign that we see is anemia. So they look pale. They look more, when you check, their hands look more white than pink as it is for most normal babies. They have multiple infections. So they tend to be admitted most of the time, and they have crises. So they have pain in the joints. They have pain in the long bones. They have headaches. They may present with other crises like chest syndrome, so acute chest syndrome, where they have difficulty breathing, they have chest pain that is severe. They can also present with strokes. They have weakness on one side, or they get convulsions. So the strokes can also be like a bleed or a blockage of the blood vessels, which is said thrombotic. And they present with weakness on one side, convulsions, or difficulty walking or standing up. They can have feeding difficulties, and some of them will eventually need assistance in terms of feeding. They sometimes present with delayed milestones. They can have a slow rate of growth compared to their peers of the same age. So at Aga Khan Hospital, Kisumu, we have a sickle cell disease clinic, which we run every Wednesday from 9 a.m. to 4 p.m. We have a pediatrician who runs the clinic with the support of a hemato-oncologist. And in this clinic, we see children who have sickle cell disease, whether they are unwell or they are well. So every child who has sickle cell disease should be reviewed should have a checkup done at least twice a year. If they are doing well, they have not had any crisis. And for those who have crises or have other illnesses, then they need to be reviewed more frequently. This will be assessed by the pediatrician, and the pediatrician will let you know how often to come to the clinic. So you're welcome to our sickle cell disease clinic.